Welcome in, and thanks for joining us here on America's Retirement Headquarters, home of the Retirement Guys formula and America's Medicare Associates, Nolan Baker and Scott Kirshner. Myself, my name is Chris Swan. We really are glad that you're here with us today. Here's how you reach out, 419-794-3030. It's 419-794-3030, online at americasretirementheadquarters.com. On today's show, we're going to take a deep dive into Medicare. The annual enrollment period is in full swing, so what do you need to know about it and or possibly do if you're continuing to work past 65? Should you sign up for Medicare or stay on your employer's plan? And how important is it to know exactly what your Medicare plan really covers? All that and more. Before we dive in, though, let me check in. Nolan, Scott, glad to be with you guys as always. How are you?
I'm great. Good afternoon. Good to be here. It's just been the last several days kind of working on our upcoming event that we're doing to help support Hooves. So Hooves uses veteran horses to rescue veterans suffering from PTSD. We've got a big event coming up next month, November 13th. It is to help raise some funds. We've got a chili cook-off and a craft beer tasting night over at Valleywood. And we're really excited. We've got a great group of people coming out to that event. But if you haven't signed up yet, I'd encourage you stop on over to Hooves. That's HOOVES.US. Click on the events tab, and you can register to come out to that event. I think anything we can do to help, save some lives of local veterans, that's what we're all about. And it's a good organization that I'm happy and proud to be part of.
Yeah, Nolan, I'll add to that. So this past week, my son is working at a chiropractic, Anti-Wayne Chiropractic in White House, Ohio. And he says, Dad, tomorrow I get to go to this place where they have horses. And right away, because, you took the team there for a little team building here a year ago, I said, where's it at? He said, I don't know where it's at. It's someplace in Swan. You know how 19-year-old kids are. They don't know anything. You ask them questions, they don't know. I said, is it a place called Hooves? He says, yeah. I said, Troy, that is an awesome facility. He says, but Dad, I'm afraid of horses. I says, no worries. Amanda out there, she'll take care of you. It's a great facility. So they're doing a little team building there. They did an event this past week, and he loved it. It was a great time for him.
Yeah, we had a chance to speak with Amanda from Hooves a couple weeks ago. You can check out that show as well as previous editions of the show via podcast if you just look up America's Retirement Headquarters on Spotify, iTunes, or YouTube. But let's go ahead and dive into the show. If you want more information about that event, by the way, just go to hooves.us for more information, including how to go ahead and make sure that you'll be there. But let's dive in. Like I said, the show is about Medicare, and like so many things about retirement, Medicare can be pretty confusing. All the commercials on these days talking about the annual enrollment period, well, it kind of muddies the water even more. So, Scott, I'm gonna ask you here. If someone is currently on Medicare, how does this period affect them, and what, if anything, should they be doing? Also, really quick, it's a two-parter. I keep hearing about the term open enrollment period. Is that the same thing, or is there a difference?
Well, the easy part of that question I'll answer first. It is not the same thing. A lot of people refer to it as open enrollment, but it is definitely, there's differences. The annual enrollment period starts from October 15th, so it was just a week or so ago, and it runs until December 7th. Now, the important thing about the annual enrollment period, this is when anybody that has a Medicare Advantage plan or a prescription, a standalone prescription, and they're called PDP plans. This is when you can make a change to those plans. So, for example, if you've got a doctor that maybe has left the network or a hospital that's left the network, or the plans change for 2022 and they have maybe higher co-pays or higher out-of-pockets and you want to make a change, this is the time when you make that change. Now, something to be really aware of, a lot of people have the Medicare supplemental plans. They're different than the Advantage plans. This annual enrollment period really does not pertain to the Medicare supplemental policies. Typically what happens with the Medicare supplement, that effective date is the first day of the month you turn 65. So your annual renewal date would be whatever that, if it's, say, March 1st, then your renewal date for your supplement is every March. But your prescription plan would be January to January to January. And that stands true for an Advantage plan. The Advantage plans, you can make a change in that annual enrollment period. Now, what the open enrollment period is going to do for you, now that runs from January 1st through March 31st. You get kind of a do-over, so to speak. If you make a change and then decide that maybe that wasn't the best change for you, you might not feel comfortable with whatever change you made, and you want to go back to the other plan you were on, you can do that one time starting January 1st, and that runs until March 31st. So it gives you some options to play with if you're just not comfortable with that change. You know, like I mentioned, I had a commercial running out there for a little bit. If you're one of the things that typically happens, there's a company here in Maumee, Paramount. Paramount Elite is no longer taking in network hospital for McLaren St. Luke's. So if you're in the area where, and your hospital of choice is McLaren St. Luke's Hospital, and you have Paramount Elite, effective January 1st, you're no longer going to be covered as in-network services. And that also stands true with the some 148 physicians with the WellCare Physicians Group. So one of the things I do is I help with that, and you know, if someone's got a need to make a change for that, that's kind of what I do through this annual enrollment period.
And, you know, when I think about it, if I think about the top biggest concerns, I say for folks that are close to or in retirement time, you know, number one is outliving their income.
Mm-hmm.
And, you know, healthcare is kind of be in the top 2 or 3. It's obviously a major concern for folks. And I think of a recent example of a, you know, friend of ours that is unfortunately in the hospital with COVID. They've been on a ventilator. You know, I just can't even imagine what the bills and expenses are that have accumulated just over the last couple of days. And, you know, fortunately, they have kind of a long battle to go.
Right.
I think a big area for concern for folks is not really understanding kind of what their coverage is, understanding kind of what the plans are, what is covered, what isn't covered. You know, oftentimes when we think about it, it's, you know, multiple pages long. There's, of course, like declaration sheets that give you some ins and outs. But when we look at it on TV, I mean, I sit at home at night and I watch TV, and you see commercials stating that the Advantage plan, you get all of these kinds of things with a zero premium. Is that really true?
Well, actually, yes, it is true. You know, you do get the dental, the vision, the hearing, the prescription, meals. In some cases, with some companies and some plans, you can get a portion of your Medicare Part B premium back. That is all true. Zero premium, meals, transportation, silver sneakers or gym memberships. That is true. But what is typically not being said during these commercials is, what are you going to be paying for? I mean, nothing is free. I mean, let's face it. You know, it's too good to be true. If everything is 0, 0, 0, how in the world can these insurance companies handle that? Well, they can't. What are you paying for? And one of the things about a Medicare Advantage plan, it's a pay as you go or a pay as you need. So, for example, yes, you get all of those included at zero premium. If you're healthy, you don't have any medical expenses, you're not going to pay anything for that year. But Nolan, you mentioned you've got someone that you know that's in the hospital and struggling with that. And, you know, on previous shows, I mentioned my family. I love to use real-life examples. You know, my mother was in and out of the hospital several times. There was a period of about 8 to 10 weeks where she wasn't even home. And it was a welcoming sight to get her home. But you have office co-pays. You have out-of-pocket expenses that you're not being told about on these commercials. That's why it's important to have an advisor. That's why it's important to have someone like me to go through all of those coverages. For example, an Advantage plan, it's going to give you office co-pays. Your physician fees are typically zero. To go to a routine physical checkup at a doctor, you're not going to pay anything, but you're going to have an emergency room of a $90 copay, urgent care a $30 copay, inpatient hospital days 1 through 5, 1 through 7, depending on the company, depending on the plan, you could have anywhere from $275 to $395 a day. And you have a maximum out-of-pocket expense. So you may have anywhere from a $3,400 to $7,500 maximum out-of-pocket. That is different than a deductible. Deductible, like a lot of people look at that and say, well, a deductible, when you have health insurance under 65 years old, you have a $3,000 deductible. You have to reach that deductible before the insurance company pays.
Mm-hmm.
That's not how it works with an Advantage plan. If you're in the hospital for 5 days, you could have an expense of somewhere between $1,800 to $2,000. If that's the only thing that happens to you in that particular year, that's all you pay. So a lot of things that you don't hear, that you don't see, are what are your out-of-pockets. And it's important to understand what you have. I met with a client this past week, and I wrote them an actual Advantage plan. And one of the big factors, it was about the same out-of-pocket exposure that they would have on a supplement. Their premium was about $3,600, and I wrote them a plan with a $3,600 maximum out-of-pocket. But what really turned the tables for this particular client was an Advantage plan is going to give you over-the-counter drug cost. So think about it. If you have a Zyrtec, or if you have contact lenses and you need solution to clean your contact lenses, or if you have bandages or any supplies or anything you need, those are out of your pocket expenses. Those are things that you pay for. Well, with most Advantage plans, you get coverage for those over-the-counter expenses. Some of them can be up to $300 or $400 a year. So when you look at that, it really, plays a big factor. A lot of people don't realize that if you're on an Advantage plan, you have the availability to have transportation to and from your primary care doctors. A lot of people don't even know that. So it's very important to know what you have so you can kind of figure out, help you make the right decision whether you want to go with an Advantage plan. Medicare supplements, much easier to use because there is a simple deductible for Part B. The deductible, from what I understand, moving forward is going to go up a little bit. Those numbers aren't released yet until after November 1st. But typically with a Medicare supplement plan, you're going to have 100% coverage for hospitalization, and you're going to have a very low deductible on an annual basis. But it does not come with all of the bells and whistles that you see on the commercials. You'll have to purchase a standalone drug plan. It doesn't have prescriptions. It doesn't have dental, vision, or hearing aid coverage on a supplemental plan. So, but it has the flexibility of travel. So there are, give and takes on both sides. There's not one that's better than the other for anybody's individual needs. It's just a matter of sitting down and making sure that it's going to work best for you and cover what you need.
Well, it's really like, taking into consideration your individual situation, right? Like we talk about
Absolutely.
with finances, and looking at, what your health is now, maybe what some of the health challenges that you have in the future. And again, there can be some differences on, when and or your ability to make changes within your plan. And then I think another big part of it comes into some different time frames that people move through in life. For me, there's a lot of different numbers that jump out for somebody close to or in retirement time. As an example, at 59 and a half is the first time, somebody could access money from a traditional retirement account
Mm-hmm.
without paying an early withdrawal penalty. They might have the ability to do like age-based in-service 401k withdrawals. You've got 62 is the first age people are eligible to be able to draw Social Security. You've got, 65, which what we think about like today when we're talking about Medicare, or, 66 for a lot of people is full retirement age for Social Security. Then you have like 72 where required minimum distribution. So, when you're backing up these deadlines and you're looking at individual situations, I think another big thing that I hear oftentimes from folks is, I want to work past age 65 and I'm going to continue working. Maybe they love what they want to do. Maybe they want to save up a little bit more money. But, when we think about 65 as the Medicare age, do people need to sign up at age 65 if they continue to work?
Well, Nolan, that's a great question because, back in the day, and I don't even know, that phrase back in the day, what does back in the day mean? Well, when I say back in the day, I mean back, 10 years or so ago, the norm was you turn 65, you retire. You sign up for Medicare, you start your retirement, and you start living your retirement life. That has changed drastically, I would say, probably within the last 4 to 8 years, maybe 5, 6 years. Because what's happening now is people are working past 65. One of the things this past week we had a Social Security and a Medicare event and had a great turnout for 2 days of that. But one of the things as Chaz Price was going through the Social Security, a couple of questions in the audience were, okay, so I see this full retirement age, but I don't want to retire. And I think a big misconception with that is that doesn't mean you have to retire. That's when you can collect your optimal Social Security benefit. Well, not the optimal. To get the most bang for your buck is wait until age 70. So people are working past 65 now more than they ever have. So here's what I do with that. I'll sit down with someone that is contemplating staying on their employer plan. And it's all a numbers game at that point. It's very simply a numbers game. What I do is I ask these simple questions. One, how much are you paying for your employer plan? And then I'll ask, well, how much is your out-of-pocket expenses? Because most employer plans may have a large deductible, a $3,000 to $5,000 deductible. So that's your out-of-pocket expense. So if I've got someone that's paying their portion of the employer plan is $300 or more, and they have some significant out-of-pocket expenses, then what I'm going to do is I'm going to say, okay, so Medicare, which, by the way, Medicare Part B is going up in 2022. The standard, it was $148.50 in 21. In 22, it's going up to $158.50, a $10 increase. So I'll take that number, and then I'll look at a supplemental plan, which generally is going to run somewhere between, depending on the situation, maybe $125. And then I'm going to look at how much is it going to cost for a drug plan. Typically, a drug plan is going to cost you somewhere between 15 and 20 bucks. Well, all said and done, Medicare is going to, the average is running right about $300 a month for a person to sign up for Medicare. Now, that changes a little bit if you go with a Advantage plan, because then you're only paying for your Medicare Part B premium. So then I look and say, okay, if you keep your employer plan at $300 is a wash, your cost. Now we look at what is your out-of-pocket expense. So if your out-of-pocket expense is a high deductible for your employer plan and a $200 and some odd dollar deductible for Medicare, then it makes sense to go on Medicare. I had a couple of clients in this past week, and she's a nurse and she's looking to retire, and I told her, you're far better off staying on your employer plan. Now, something else that comes into play with that is if you are married and your spouse is not ready to turn 65, I mean, nobody's ready to turn 65, but if their birth date prohibits them from being 65 and eligible for Medicare, then you have another issue to think about. And that is they're not eligible for Medicare, so they'll have to go on the open market or Obamacare, the marketplace, the Unaffordable Care Act, and sign up for that. So that comes into play with deciding on whether or not it's a good idea to take Medicare through your employer. The important things to remember, and this is crucial, if your employer-sponsored plan meets the minimum requirements put forth by the CMS, the Centers for Medicaid and Medicare Services, then you do not have to sign up for Medicare. Now, if for some reason it does not meet those standards, or let's say you do not have a drug card with your employer plan, then it is crucial that you sign up when you are eligible for Medicare, because you could face penalties. And another thing to keep in mind, COBRA is not credible coverage for Medicare. So if you decide to take COBRA, put off signing you up for Medicare, you could face penalties. And we want to make sure that you don't face penalties. We want to keep those penalties out, keep you away from the penalties. The penalty for not signing up for Medicare when you're eligible is 10% per year on top of the Medicare Part B premium. So if you miss it by 2 years, it's 20%, 3 years, 30, and so on. It's not capped. So it could go up to 100%. That's for life, as well as the prescription penalty is 1% of the national average. There's a formula for that, and that is also a lifetime penalty. So we want to make sure that we keep you away from the penalties. That's very important.
Let me clarify something here really quick, Scott. So if you are working, a great example, my mother and father, they're both Medicare eligible right now. They're both still working, and so they're not, they're on an employer-sponsored plan. If they wait to claim, are they going to be subject to the penalty when the time comes where they are no longer working and they do elect to take Medicare?
No, if they have credible coverage and they wait to sign up, say at 70 years old, then that's what's called a special enrollment. There are no penalties at that time.
Okay, because I was getting ready to text them and be like, hey, you got to get on Medicare right away. But no, that's a very important distinction. And
Yeah.
we're throwing a lot of numbers and a lot of factors and generalities here. But really quick, let me throw out the most important number, and that is how you get in touch with America's Medicare Associates and America's Retirement Headquarters. It's 419-794-3030. If you have questions about Medicare, whether it's reviewing your plan, whether it is what your plan does and doesn't cover, or whether it's a good idea to stay on your employer plan, that's how you reach out, 419-794-3030. Or you can go online to americasretirementheadquarters.com or americasmedicareassociates.com. Let's put our eyes to the future here, guys. We are in the annual election period, or annual enrollment period, where people can make changes to their plan for the coming year. So let's talk about 2022. What exactly is changing?
Well, one of the things that have changed for sure that we know that has already been released is Medicare Part B, the basic, and I've already mentioned this, is going up by $10, $158.50 for the standard Medicare Part B cost. Your prescriptions, the prescription coverage, the standard is a $445 deductible. That is going up to $480 deductible for 2022. Now, the good news is, I've already been working since the 15th. My calendar is slammed right now, and I love it. This is what makes me tick. I know people think I'm nuts, but it makes me tick. The good thing is, what I'm finding is a lot of these prescription plans are having a reduction in premium. So that's a good thing. There are a couple of the companies out there that are actually lowering their premiums a little bit. So those are the things for prescriptions. Also, the donut hole or the gap, the amount of coverage for the retail cost of drugs has gone up $300 from $4,130 to $4,430. What that simply means is that's how much you would have to pay until you get to the gap. Then when you exit the gap, it went up $500. It was that threshold was $6,550. It is now $7,050. So those are some of the changes in the prescription plans coming forward, and that's standard across the board, by the way. As far as the coverage changes for original Medicare, those have not been released. I check daily. Rumor has it that those are going to actually be released after the 1st of November. So I really don't have a lot of information on that. I don't think anybody out there does really at this point. But as soon as that information becomes available, I will be throwing that on my website, americasmedicareassociates.com, where you'll be able to find all of the updates and any information that has changed. But that's what's coming down the pipe right now for some of the changes that we know of in 2022.
So with that in mind, would it benefit people to wait until November 1st to schedule a time to speak with you, or could they go ahead and start making those plans and reviewing now?
Well, with original Medicare, it really doesn't matter what those changes are going to be, because your supplements and your Advantage plans are going to cover whatever out-of-pocket expenses you're going to
Mhm.
have. The only people that would really be affected by that is if you signed up for Medicare and didn't purchase any other type of supplemental policy of any type, whether it's Advantage or a supplement. Then you're going to be hit with those out-of-pocket expenses where Medicare doesn't cover. So, I would encourage anybody at this time, I would sign up for an appointment. The sooner the better to get this off your plate, so something you don't have to worry about, especially heading into that dreaded holiday season, right? But I would go ahead and sign up as sooner the better for and make changes.
Yeah, so many things get lost in the wash. You think to yourself, oh, I'll do that next week. I'll do that next week. And the next thing you know, it is the end of December. And it's going to be really hard to get into the calendar at that point. So go ahead right now. Go ahead and schedule the time. Speak with Scott. Review your plans for 2022 and avoid any unpleasantness you're going to have either at the doctor or the pharmacy come January 1st. 419-794-3030. Once again, that number is 419-794-3030. You can always find them online, americasretirementheadquarters.com or americasmedicareassociates.com. And as we always do every week, we want to thank you for joining us this week. Hope you have an excellent week ahead of you. Hope you stay safe out there. And as we wrap up, gentlemen, I want to leave you with the final words.
Well, I want to thank everybody for listening. I know I kind of inundated the show with Medicare, but it's important. It's important for people to understand it, especially at this time of year. And I really appreciate and thank all the listeners out there. And Nolan, anything to wrap up? Any quote for us today or anything?
Yeah, we look forward to seeing everybody next week. So enjoy the rest of the beautiful fall weather. And I know it's cooling off, but we look forward to seeing you soon.
like listening, waiting for a sign.
Yeah, there we go. We're good.
He gave us the sign. I just was staring at him.
Hey, so you should know this very well, Scott. There's talent, which doesn't quite get the same thing as the studio development. They were just blankly looking at my thumbs up. Like,
Well, I think in one